How do you YouTube? Nick Pratap here from Next Gen Rehab, and in today's video I'm going to be talking about exercise after a bypass surgery. Now, if you have any specific questions related to your medical history or any procedure you've had in the past, please bring those up with your family doctor. Now, when it comes to bypass surgery, who is this normally intervention that's prescribed for? So if you've been experiencing chest pain and you've seen your cardiologist and your cardiologist has sent you for testing, maybe a stress test, very commonly you'll most likely have gone for an angiogram of some sort to see the vessels themselves. And after that stress test, if it came back positive and the angiogram shows that you have multiple blockages, especially blockages in the main arteries of the heart, the right coronary artery, the left anterior descending, the circumflex. If there's major occlusions in these arteries, if it's what we call diffuse, multiple arteries are blocked, there are extended long blockages that cover the majority of the length of the arteries, then usually a stent is not the first line of procedure. In these situations, your cardiologist is going to refer you over to a surgeon and elect for you to have a bypass surgery done. Now, depending on the extent of your symptoms, you may have an elective bypass where they set a later date for your surgery, or if you've experienced a significant chest pain and you present to the hospital, now they may elect to do an emergency bypass after consulting with the surgeon. Now, the procedure is quite invasive. Again, they're breaking through the sternum in order to get to the heart, hence the term open heart surgery. And so there is a significant amount of healing time post-surgery. Now, after the surgery itself, what tends to happen is you're going to be going through a period of healing. You're going to be prescribed certain medications. Some of these medications may include statins to help regulate that cholesterol. You may be put on a blood thinner like aspirin to regulate any formation of clots. You may be put on a medication to reduce spasms of your bypass graft, specifically if you've had the radial artery used as one of your grafts. A medication like amlodipine may be prescribed to prevent any sort of spasming of this graft. You may be put on a beta blocker of some sort, toprolol, bisoprolol, for that initial period of time over the course of 6 months to a year, maybe longer depending on your cardiologist's take on your history. This is normally prescribed for patients in those initial phases to prevent any sort of rhythms from occurring, things like atrial fibrillation. And another medication you may be prescribed is some sort of a blood pressure medication, especially if your heart function has been reduced, like something like ramipril, to make sure that your blood pressure doesn't get too high while your heart is going through the healing phase. And another reason for that beta blocker is, again, to control that heart rate so that we don't see significant increases in heart rate again while your heart's going through that healing phase. You should be following up with either your cardiologist, surgeon, as well as your family doctor in specific intervals post-surgery. This is just to make sure that the graft sites where they were harvested from, whether they take a graft from your leg, whether they take a graft from your arm, whether they take what's known as an internal mammary artery, one of these grafts, just to make sure these incision sites are healing up well. Obviously, they're going to look at your sternum. They're going to ask you questions like if there's any clicking, if there's any pain, discomfort from the incision site. So your GP specifically and your cardiologist and obviously your surgeon are going to be working with you just to make sure that the healing procedure is going right. And if at any point you experience any sort of distress, something doesn't look right, they will advise you to go to the emergency room, especially if there's some sort of an infection or any other abnormalities that may present itself. And then the periods after the surgery are essentially surrounding the recovery. The cardiologist recommends no heavy lifting post-surgery. You want to limit it to about 10 pounds or less. Again, this is in an attempt to allow that sternum to heal up before you start putting any sort of pressure on it. In terms of intensive activities, again, they're going to refrain you from doing that, but there's nothing wrong with going for walks. And so if you have been referred to a cardiac rehab program for lifestyle modifications, obviously recovery of heart function, getting your cardio aerobic capacity back. And typically what the cardiac rehab team will do, the cardiologist on that team, is refer you for a stress test. So during the stress test, again, to see how, well, are the graphs doing what they need to be doing? Is there any sort of changes in your ECG that would note any sort of ischemia or deprivation of oxygen to the heart? We're also going to be monitoring for any sort of abnormal heart rhythms. Is there any atrial fibrillation, atrial flutter? Are there increase in what we call PVCs or any sort of tachycardia, that fast heart rate, extra beats? So we're going to note these things, and obviously our cardiologist is going to follow up with you about this. But also what we're trying to look for is, in terms of your exercise capacity, how hard are we able to push you to get a baseline measurement? And using these measurements, again, as an exercise physiologist, we're going to be able to make an exercise prescription for you, all right? And so once you get referred over to the cardiac rehab program, we're going to slowly start building your capacity back up. Again, just like some of the other videos I've used previously, we do want to promote movement. We don't want you to just, after surgery, just be sitting there and doing nothing. Light walking within your home is okay. Again, just monitoring for any sort of symptoms. Now, when you do come into the cardiac rehab program, what we're going to start focusing on is gradually increasing your intensity again. So using things like the rating of perceived exertion scale, the RPE scale, which is a scale from 0 to 10. Ideally, we're training you at a moderate range, which is about 3 to 5 out of 10. And to define this, normally we say, is the patient able to talk? If you can talk, great. As soon as you can't talk anymore when exercising, you need to slow your intensity down. If you can whistle or sing while performing exercise, we have room to push your intensity a bit more. We're also going to be using your target heart rate, which we would have obtained from that stress test, in an attempt to get you into a target heart rate range when you're exercising. The protocols for exercise are still the same after you've had any sort of heart event. We want to get to at least 150 minutes of moderate aerobic exercise a week. This breaks down to about 30 minutes a day, 5 days a week. We will start to implement strength training, not only in attempts to just build up overall strength, but to build some of the muscle back in the chest, the anterior deltoid. After having bypass, we tend to see a lot of atrophy in this area, so we want to work on this. We also want to focus on stretching, right? Typically after a patient has bypass surgery, they get into this kind of hunched over position, which is a normal response for the body. So very slowly, we want to start opening the chest back up by setting the shoulders down and back. We want to slowly start to focus on stretching the pectoralis major muscle, some of the anterior deltoid. Again, all within context of what your body is giving us for feedback. If there's any sort of pain or discomfort, you've probably pushed too far. And so we need to ease up on the stretch or give you a modification to the stretch until you're ready to slowly start increasing that intensity. Okay? It's highly recommended to do some sort of supervised exercise in a cardiac rehabilitation setting, so you can be given proper guidance and guidelines and specific intensities to work towards while you're going through that recovery phase. Again, and just like any sort of surgery, you have a knee surgery, a surgery on your lower back, you don't typically just go from doing nothing to 100% right away. You want to be able to go through specific stages as you progress with that recovery, and the heart is no different. We want to start slowly, but over time, our goal is to get you back to the levels of exercise you were doing prior to your surgery without having any sort of discomfort or symptoms. So hopefully that video was helpful. If you have any questions, please feel free to leave them in the comment section below. Once again, my name is Nick Pratap from Next Gen Rehabilitation. We'll see you in the next video.